Welcome to the OVA vlog. This is part 2 of our series on the pelvic floor. I'm here at HCMC with Beth Stegora, who has a doctorate in physical therapy with a certification in pelvic floor and OB. So she is the perfect person to be talking about the issues that women might face with their pelvic floor. This is our second episode, so if you have questions about what the pelvic floor is, go back and watch the first one. This one is all about how you know when you need to go see a pelvic floor physical therapist, how you can find the right one, and what might happen during that first appointment. So, Beth.
So I would say the definite message is look into help earlier than later. So as soon as you're noticing any symptoms, and by symptoms, I mean any leakage, urinary leakage with coughing or sneezing, or that intense urge to urinate, those are big signs to go and get help right away. If you're not having any pelvic pain, that would be a sign to go and get help. And then if you notice any heaviness in your pelvic region, so after standing or running for a long period of time, if you notice some heaviness in that area, that would be a time to seek out somebody who's trained in physical therapy. And so not everyone is trained in pelvic physical therapy, and so there are special certifications beyond the doctorate of physical therapy program. And so a physical therapist needs to attend training to be certified in pelvic physical therapy, and there are different levels even within pelvic physical therapy to be certified in. And so as a patient, you want to make sure that you seek out someone who is trained in pelvic floor muscular, to be able to educate you about the pelvic floor musculature and to be able to examine you properly. And so one of the easiest ways to find pelvic physical floor physical therapists is to go on our national website, which is aputa.org.
We'll have a link to that.
And you can search Women's Health Physical Therapists and put in your zip code, and that should be able to help you locate those in your area. And so after you, when you see that physical therapist, part of the examination would be a thorough intake of your bladder habits, your bowel habits, all different sorts of things with your diet, and how much that this problem has impacted your life. Then the examination,
which is just like a questionnaire.
A conversation with your provider to really see how much it's impacting your life, and it usually is impacting people quite a bit that they seek help. Some parts might even include keeping a bladder diary, and so being able to have objective information about your pelvic, your bladder habits. And then the objective examination would include checking alignment of the pelvis. So checking, especially your postpartum, to make sure that the alignment of the pelvis is correct. Checking some mobility, or checking to see how the sacroiliac joints are moving, because
which is just the sacrum area.
These two joints where the pelvic bones are coming into the tailbone.
I only know that term because of yoga. We talk about the sacrum all the time. I'm like, what?
Yes, very important. And so there would be an external examination to check all of that alignment. And then physical therapists who are trained in vaginal examinations will first look at your musculature to see where your pelvic floor is resting.
So that might mean like a speculum and
nope. So no speculums.
Oh.
No, yeah, much less invasive than pap smears and things. So just an observation, you want to check to see where the perineal body is resting, just within the pelvis, just in a resting. You can check coughing and sneezing, so they might have you do some coughing in that position. And then there could be an internal examination. So the physical therapist would insert their pointer finger to about an inch or two depth-wise, and you can check the integrity of the pelvic floor musculature. So you can check the ability to contract and hold for prolonged periods.
Which is what we might think of as a Kegel.
Right.
Okay.
But usually, a lot of times I see women who try to do a Kegel, but they're squeezing their glutes. Or they're squeezing their thighs.
Yeah.
And so it's great to get that internal examination to really isolate the pelvic floor, and your physical therapist can determine if you are able to contract those muscles. Okay. You can look at which are, once again, these muscles. Yeah. So when you are putting your finger in, are you moving these muscles rather than these muscles? Correct. Yeah. Because the urethra is not passing through your glutes, it's passing through your pelvic floor musculature, so they can't stop urine. So, so you can check the endurance, you can check, you want to check elevation. Part of the normal contraction of the pelvic floor is to squeeze close but lift. And so a lot of women are really good at squeezing close, but they can't get that lift portion. Okay. And so you will get tested on that as well. There are certain parts of the objective examination that could include some biofeedback, which can be done with surface electrodes placed on the outsides of the muscles, so on the skin on the outside, and you would have a machine then that would give you some visual feedback about your ability to contract those muscles. Really, really helpful for patients who really just can't figure out how to isolate those muscles. There are also vaginal and rectal sensors that your therapist might use. And so they would be inserted about this far in, and they're no bigger than a tampon. And so you'd have that inside the vaginal canal, and you're trying to squeeze that, and then you will also get some readings on the biofeedback to help you. So having a really specific examination is really important for your own pelvic health, because that's how you decide what your home program is going to be. So if you can't isolate and close your pelvic floor and squeeze it, and you're doing it wrong, you're just, recreating bad patterns. Yeah. And if you're overcompensating and helping with other muscles, you're always going to keep doing that. So it's really important to make sure that you're doing it the right way. Okay. And another, in this conversation, I've really taken away a couple things. One is, if you are feeling discomfort, that does not have to be normal. Mm-hmm. So seek out a pelvic floor a physical therapist with a pelvic floor certification to get it looked at. 2 is to go early. Mm-hmm. Start before it really becomes a problem, because then you have most likely will have better outcomes. Mm-hmm. And then 3 is that you guys just rock. I actually just made that up, but awesome. So that's the end of part 2. So stay tuned for our next video, which will be all about what you can be doing at home. So thank you. Thank you.